The importance of sleep, number one, it's a global pandemic for so many different reasons. And then on the back of that, we've got sleep that's impacted by poor breathing. And that's what really lies in the professional domain of someone who works with upper airway health, and realised that the general public just doesn't know about it. And it just seemed unfair that there was this important science about sleep and this important science about sleep and breathing, and kids were suffering and adults were suffering, but no one was really delivering that science to parents or families.
My name is Christy Gatto. I am a speech-language pathologist and a certified Oriofacial myologist from Houston, Texas. Airway health is actually the foundation of speech-language pathology and swallowing. You first have to be able to breathe, and then you have to be able to swallow, and then you're able to speak, and it goes on and on. But the very first thing you have to do is you have to have a patent airway so you can breathe, so everything else can work. The more we talk, the better patient care we can give. The more we understand what each discipline is able to provide a patient, the more we can actually treat the whole patient and not one symptom.
My name is Sandra Valpo-Pinkerton, and I am an oral myofunctional therapist practicing in Los Angeles and being part of the Breathe Institute in Westwood and Calabasas. We kind of start to learn about each other professions, so we kind of, as a myofunctional therapist, I can pick up on red flags on my patients, and that is really a great help because that's how we learn how to communicate to each other. How do we know and who to approach? Is that a PT? It is an OT? It is a speech pathologist? For my end, that's what I think it's phenomenal because all those type of professionals are coming and joining, and I will just feel like it's such a great opportunity to know about what other professionals are putting their efforts and from their angle how to do the best care, to provide the best care for the patient.
My name is Nicole Archambault. I am a speech-language pathologist by training. I do practice myofunctional therapy, and I have a background in educational neuroscience, and I would consider myself a sleep and airway advocate. There's a lot of talk about exercises, and you know, as clinicians we get asked, could you just give us a handful of those exercises? But it would really be doing a disservice to a patient, right? Because you individualize your treatment, that it really is so much more than that. And I also hope that we will help build the conversation around the fact that children and adults are so much more than their mouths, that we need to keep building, yes, the mouth and the airway are foundations to all these other things that we do, but that we keep seeing those connections and realizing that this really is a whole person, and to keep our lens expansive and not to get too myopic and stuck on one thing like a tongue tie. People are willing to collaborate, and we really need more of that in healthcare.
Joy Moeller, a myofunctional therapist and a dental hygienist. I feel real strongly that the AAPMD will continue inspiring people to team up to make a difference in people's lives, because sleep apnea is taking over our world, and it's estimated that 80% of people have some type of sleep disorder. Let's inspire people to do the research and the heavy lifting. You will learn things that you can actually put into your practice to make it better, to help more people.